Hi, I'm Dr. Stephen Cohen, an internist working in Austell, Georgia, a suburb of Atlanta. My goal today is to teach you how to use a tool on the website Medicare.gov to potentially save thousands of dollars a year on your costs for medicines. If saving this much money for yourself, your relatives, or your friends on Medicare sounds appealing to you, please join us. Over the next 15 minutes, you'll learn how to do this. The time when you can change to a new Medicare D or Advantage plan is called the open enrollment period. This year, the open enrollment period is October 15th through December 7th. There are several exceptions to this deadline. If you're turning 65 in the coming year, you'll have some additional time to apply for the plans. There are several other situations which permit a person to enroll in a Medicare D or Medicare Advantage plan outside of the dates of October 15th through December 7th. To see a list of these exceptions, go to MedicareDrugSavings.org and click on Enrollment Date Information. If you put it off, you'll have to wait another year before you can do this. In my job as an internist, a physician caring for adults, I've taken care of thousands of adults on Medicare. Unfortunately, I've also seen people on Medicare have trouble paying for their medicines, even if they've had Medicare D prescription drug plans or Medicare Advantage plans which help pay for their medicines. I recently spoke with a woman that I've been seeing for many years as a patient. She tearfully told me that she would be leaving the area. She said that she was not able to pay for the cost of her mortgage, her food, and her medicines. Because of this, she was moving to another state where she would be living with relatives. After hearing this story, I felt it was important to do what I could to help people like her and people like you who can benefit from lowering the cost of your medicines. Remember, as we go through this exercise today, the best plan for you is going to depend on what medicines you're taking. One insurance plan may be better for you, while another may be better for another family member. This is the result you're going to see at the end of the exercise. This shows a saving of $2,886 for someone taking 7 medications, 1 for asthma, 2 for diabetes, 2 for cholesterol, and 2 for high blood pressure, if they choose the least expensive Medicare D plan as opposed to the most expensive Medicare D plan. The least expensive plan would cost this person $2,426 per year for their medicines, while the most expensive plan would cost $5,312. I would mention the annual cost of these medicines for someone who did not pick a Medicare D plan would be $7,376 per year. This shows how most people can save a significant amount of money by enrolling in a Medicare D or Medicare Advantage plan. We're mainly going to be talking about the Medicare D prescription drug plans and the Medicare C Advantage plans today. When you hear Medicare D, think Medicare drugs, since the Medicare D pays for medicines. But before we do this, let's talk about the different types of Medicare coverage. Medicare A helps pay for inpatient care in hospitals and nursing homes. Medicare B covers outpatient care such as doctor bills, blood work, lab tests, x-rays, and physical therapy. Medigap plans are sold by private insurance companies. We're not going to talk about those in detail today. The traditional Medicare plans, types A and B, require the patient to pay a deductible before they start to pay the bills. In addition, Medicare only pays for 80% of the bills from doctors and hospitals, so the patient has to pay the rest. Typically, a Medigap plan will cover the remaining 20% of the bill and the deductible, which traditional Medicare A and B don't cover. While this can be helpful, the Medigap plans do not pay for the medicines. Medicare C, these are the Medicare Advantage plans which are offered by private insurance companies. The premiums and covered benefits can vary between plans. They may provide additional benefits like vision care or dental care, which aren't covered by traditional Medicare A and B plans. However, they may limit which doctors, hospitals, and pharmacies you can use. So if you select a Medicare Advantage plan, you want to look very carefully to make sure it meets your needs. It is very important to understand that if you pick a Medicare Advantage plan which does not cover your doctors or hospitals, you will have to go elsewhere for your care if you want the insurance to pay the bills. Medicare D plans are the main subject of our talk today. Medicare D as a benefit was started by the federal government in 2006 to help pay for outpatient medicines. Anyone who is on Medicare A and B can sign up for Medicare D medicine coverage, but you've got to sign up for it to get it. If you don't sign up for it, Medicare won't help pay for your medicines. Again, remember the deadline this year for this is December 7th. The Medicare D plans are purchased from insurance companies like Blue Cross and Blue Shield, United Healthcare, Aetna, and many others. There's hundreds of insurance companies which sell Medicare D plans. A lot of pharmacies such as CVS, Walmart, and Walgreens, An organization such as AARP may market a Medicare D plan. However, the plan they market may not be the best one for you. Your annual costs for medicines on a Medicare D plans include three things. There's the monthly premium. This is what you have to pay the insurance company every month. There's the copay. This is what you have to pay each time you buy a prescription. The copay will vary from one medicine to another. It could be $2, $5, $20 or more. Deductible. This is how much you have to pay before the insurance company starts paying for the medicines. Some insurance companies have a deductible and some don't. A Medicare D plan will usually pay for some but not all medicines. This is important because if you sign up for a plan which doesn't cover your medicines, you'll either have to switch to a different medicine or pay for the medicine yourself. So there are hundreds of insurance companies which cover different medicines, charge different premiums, and different copays. How can you ever figure out which plan offers the best value? Well, be patient because we're going to be getting to that very soon. Before you sign up for a plan, you really need to decide if a Medicare D plan is right for you. Since most people on Medicare spend a lot of money for medicines, the answer is usually yes. However, some people keep insurance benefits from their job after they retire and go on Medicare. This insurance may continue to pay for medicines after going on Medicare, so there's no need for a Medicare D plan. If you have this from your job and enroll in a Medicare D plan, you may lose the previous insurance you had from your job or union. And if this happens, you may not be able to go back to the insurance from the job. So if you're in this situation, you need to be very careful before choosing a Medicare D prescription plan or a Medicare Advantage plan. Some people may not need a Medicare D plan because they have drug coverage through TRICARE if they previously served in the military or through an Indian health plan. Some people may have a Medicare Advantage plan. As mentioned above, Medicare Advantage plans pay for services from hospitals, doctors, as well as paying for medicines. If you have a Medicare Advantage plan and you join a Medicare prescription drug plan Part D, you actually will be disenrolled from the Medicare Advantage plan and return to the original Medicare types A and B. Okay, let's get started. Go to www.medicare.gov and click on Find Health and Drug Plans. Enter your zip code, then click on Find Plans. If your zip code includes more than one county, you may be asked which county you live in. If so, choose your county, then click Continue. Let's go through the first section. How do you get your Medicare coverage? The four choices are Original Medicare, a Medicare health plan such as an HMO or PPO. I don't have any Medicare coverage, and I don't know what coverage I have. After you make one of these selections, go to the next section asking if you get any help from Medicare or your state to pay for Medicare prescription drug costs. The options are, I get help from Medicaid, I get supplemental Social Security income, I applied for and get extra help through Social Security, I don't get any extra help, and I don't know. At the end of this presentation, we'll also give you some information on how you can find out if you're eligible for help to pay for your Medicare drug coverage. After answering these questions, click on Continue to Plan Results. In this screen, you can enter your medicines. You have to enter them correctly to get a correct estimate of the cost of the different Medicare D and Medicare Advantage plans. Remember that the cost will depend on what medicines you're taking, so if you enter the wrong medicines, you'll get an incorrect estimate of the cost. Type in the name of your first medicine, then click Find My Drug. In this example, we are typing in the name of a medicine called glipizide. There are a number of medicines which contain glipizide, so you are given several choices on this page. In this example, let's pick the first choice, glipizide generic. Click on Add Drug. If you were taking a combination of glipizide and metformin, you would pick the second choice. You can see that you have the choice of also selecting several brand name forms of glipizide, such as Glucotrol. Since generic medicines usually work as well as the brand name medicines, I would advise that you pick a generic medicine if given this choice. You can always ask your doctor for the branded name medicine. However, in my practice I have found that Medicare D and Medicare Advantage plans sometimes will not pay for a branded medicine if a generic is available. The next screen asks questions about the medicine glipizide which we just entered. First, choose the dosage or pill strength. Next, choose the quantity, the number of pills in the prescription. Next, choose the frequency, how often the prescription is filled. Finally, choose the type of pharmacy where you want to fill your medicine. Is this a local retail pharmacy or is this a mail order pharmacy? Click on Add Drug and Dosage. Enter your next medicine, then click Find My Drug. In this example, we're entering the name of a medicine called Zetia. Click on Add Drug. As previously, you will select dosage, quantity, frequency, and pharmacy type, then click on Add Drugs and Dosages. After you enter all your medicines, click My Drug List is complete. You then see a screen which will let you select up to 2 local pharmacies which you would like to use. Remember that if you like your local pharmacy, you can usually continue to go there even if you do not purchase the Medicare D plan which they sponsor. Here we're going to select 2 pharmacies, and you see 2 pharmacies at the top of the next screen. Afterwards, you click on Continue to Plan Results. You can then choose from 3 different types of plans: a Medicare D plan, a Medicare Advantage plan, and a Medicare plan which does not include drug coverage. Let's choose the Medicare D plan, the first choice, and then click on Continue to Plan Results. In this example, we found 25 Medicare D plans for someone taking these 7 medicines: 1 for asthma, 2 for diabetes, 2 for cholesterol, and 2 for high blood pressure. 3 of these were branded medicines, and 4 were generic. Of course, we only put in 2 of these together now, but I had entered the other 5 to arrive at these results. And what were our results? Well, let's take a look. The least expensive plan has an estimated cost of $2,426 per year, while the most expensive plan would cost you $5,312 to cover the same medicines. That's a big difference. And remember, this price difference would happen every year. It's not a one-time saving. Now, this website provides an estimate, not an exact amount of your annual costs for medicines. The total cost will vary depending on where you live, what medicines you take, whether you buy your medicines at a local pharmacy or get them through the mail, and whether you get generic versus brand name medicines. Okay, well, we found the names of these plans, so how do we sign up? There are 3 ways you can sign up for a plan. If you go to the second arrow on the page, you see that you can click on Enroll, and this will let you enroll online. If you look at the top arrow, you can click on the name of the insurance company. Clicking on the insurance company provides more information about the company, including a phone number to call for further information. You can also talk to an insurance agent. However, the insurance agent will not know what medicines you take or the approximate annual cost of each plan will be unless you use this online tool. So even if you plan to use an insurance agent, I would encourage you to do this. Remember, you can also get drug coverage from a Medicare Advantage plan. A Medicare Advantage plan pays for bills from hospitals, as in Type A Medicare, doctors, as in Type B Medicare, and medicines, as in Type D Medicare. If you would like a Medicare Advantage plan, select the second option, then click on Continue to Plan Results. The next slide shows us that there are 16 Medicare Advantage plans available in zip code 30106. The estimated cost for medicines for someone who did not have a Medicare D or Medicare Advantage plan would be $7,376 per year. Going to the right, you can see that the total estimated annual medical costs under traditional Medicare would be $10,680, which includes the $7,376 for drug costs. In the next slide, we're looking at the least expensive Medicare Advantage plan in the area. As you go from left to right, you get useful information about different aspects of the plan. It shows you that the total estimated drug costs are $2,415 if you get them at the local pharmacy. The monthly premium is $0. The deductible and copay information is seen. You are limited to only seeing certain doctors. And the total estimated cost for this plan, including drugs and other expenses, is $4,800. Remember, this is a very rough estimate as you may go to a doctor or be hospitalized more often than other people, but this does give you a good starting point. Now let's look at the most expensive Medicare Advantage plan. Notice the little symbols in the middle of the page? The D indicates dental coverage, the V indicates vision coverage, and the H indicates hearing coverage. Look at the arrow on the left-hand side which says that the pharmacy status is out of network. Remember that you previously said you wanted to get your medicines from Rite Aid or Walmart, neither of which is in the Kaiser Pharmacy network. As a result, you would pay $7,376 per year if you bought your medicines at one of these pharmacies. However, if you ordered them through the mail, they would only cost you $2,160, a difference of $5,216 per year. This shows you the importance of looking closely to understand if your estimated costs are affected by the pharmacies which you choose. On this screen, you can actually compare the different plans. If you check those boxes and then click Compare Plans, you go to another screen which gives you information on the plans side by side which you chose to compare. There are a number of resources to help people with limited income pay for their Medicare expenses, including premiums and copays. Other programs may help pay for other expenses such as food and utility bills. To learn more about these resources, go to MedicareDrugSavings.org and click on Get Help Paying for Medicare and Other Expenses. We know that a lot of material has been covered here. We suggest that before you look for the least expensive plan, that you first go to MedicareDrugSavings.org and click on Medicare Website Guide. This will let you print out all the important screens you will see on Medicare.gov. Looking at these printouts will help you make your way through the Medicare website. We really would like to do a better job helping you save money on your Medicare drug prescription costs. Please go to MedicareDrugSavings.org to complete a short survey on this presentation. If you plan on enrolling in a new Medicare D plan, please take the survey after you enroll. If you're not going to enroll in the new plan, you can take the survey at any time. Help spread the word about this. If you think this has been helpful, please tell your friends and relatives about it. You can like us on Facebook and follow us on Twitter. At this time, we only expect to use Twitter to notify you when the enrollment period for Medicare D and Advantage plans reopens each year. Thank you and good luck.